My name is Suzanne Watts. I'm the clinical nurse educator of the post-anesthetic care unit, or PACU, here at the Misericordia Hospital. So today's simulation, we did a massive hemorrhage protocol for our operative services department. It was a multidisciplinary, multi-department simulation. So what we were really looking to get out of it is we had identified some learning goals before the simulation. We looked at kind of our workflow and process in the hospital, in the department right now, and identified that giving blood or massive hemorrhage is it's a high risk workflow. So there's lots of areas for improvement and learning and process improvement for staff. So we chose this scenario for our staff so that we could really pull some of those learning points, those process improvement, quality improvement, education for the staff out of it. So what I've seen today so far is every level of the participant, from coming into the room and starting the simulation with our staff, from the nurses, anesthesia, respiratory therapists, service attendants. Those are all our staff that are in the room, and then we're also working with the transfusion medicine or the blood bank to coordinate kind of our fake blood and that process. The other thing that we have created for the simulation is a shadow environment of Connect Care, which is our computer charting environment. So that's part of that high-risk workflow. Is it's not something that we do all the time as nurses, as a massive hemorrhage protocol. So to be able to replicate the realistic steps, all the little steps, all the fine details that are involved in it, to replicate that in simulation, we're pulling out a lot of really good learning points for our staff that we can message out after this, so that we can kind of tailor education so that when there is a real massive hemorrhage protocol on the unit, our staff have the tools, the confidence, and the knowledge to be able to deliver the best patient care that they can from the learnings that they've pulled from this simulation.
We have done a full sim day previously, so this is our 5th year completing full day sims, where we try to include an interdisciplinary team and a different education topic that our staff kind of bring up and what they want to practice, what they want educationally from feedback. So this is the first time we've run the MHP as the topic for the full day simulation. Here at the Misericordia, we are one of Covenant Health's only sites that is accredited for the simulation program. So Suzanne and I have been running simulations monthly. So we've been doing smaller sims in our allotted hour time on Fridays, which we've been doing monthly, so we've been rotating topics. So we've been able to get staff through a variety of different topics as well.
Tanya and Suzanne and Charlotte did a fantastic job prepping and getting everything organized and ready for this for the staff. We had previous simulation kind of mini sim with the mass hemorrhage protocol, so we were kind of prepared, and this just brought it to the next level. With a patient that actually needed IVs and they had blood and the work, so it was very realistic, and having the staff work through this is what it takes to manage a situation like this when we actually get on the units or in the OR. I think the simulation program, every unit should buy into it and run sims, because it just makes everybody more comfortable, more competent when we do have to manage an actual situation.
I've personally been in massive hemorrhage protocol situations before, and every time you do it, you learn more about your abilities, how to be more efficient, and what your resources are. Of course, working on teamwork and effective communication is important for all patient safety.